Hi guys, welcome back to my channel, and today in this video tutorial we are going to learn about the Framingham Risk Score. So guys, as the name suggests, it is a kind of risk scoring system. So guys, it is a kind of, you can say, risk assessment tool for the cardiovascular diseases. So what is the impact, what is the chance of getting cardiovascular risk? So we are going to assess that thing with the Framingham Risk Score. And the origin of this scoring system, or you can say this descriptor or questionnaire, is from a study, that is Framingham Heart Study. So this study was basically started in the 1940s, or you can say in the 1948, and you can see a huge number of participants were there in the study. It was around 5209, and it is a kind of longitudinal cohort study. So guys, it was done in the Framingham city in the Massachusetts province of USA. So it is named so, the Framingham Risk Score. And this scoring system is very easy, and it can be implemented in many of, you can say, participants, and it is a kind of cohort which can be assessed is, you can say, diverse. So the, you can say, aim of the study was to basically explore the behavior of diseases, and this is the basically cardiovascular diseases, and identify the associated factors related to the cardiovascular risks. So the methods were basically, this was a dry lab kind of thing. So basically physical examinations and some blood sampling for, you can say, HDL and lipopolysaccharides were done, and the mainly dependent on the medical history and lifestyle of the patients. It was continued for 3 generations, and this is long lasting, you can say, project, and this project is still going on. If suppose I was assessed, my grandsons and the great grandsons are also going to be assessed. So one in 1948 was assessed, the, you can say, son, grandson and the great grandson all are in the cohort. So it is a, you can see, in the line. So the project is in line from yesterday 1948 to today, that is 2023. So the project is still going on, you can see. So you can see here that in 1968 the death rate of, you can say, heart disease were around 7.5 lakhs in America, and in 1969 it basically depleted to, you can say, 67.5. So there was a fall, and this fall indicates that this scoring system, which was invented that year, has a greater application. So you can see here in the figure that from 1950s, that 1948 till now in 2016, you can see that there is a huge decline in the death rate, and that is due to the coronary diseases. So guys, this scoring system is basically, you can say, when we talk about the definition, it is a tool to estimate the 10-year risk of developing cardiovascular disease like coronary heart disease in an individual. So guys, it is basically the main demerit of this, you can say, scoring system is that it only assesses for 10 years. So you are basically, these are the parameters. See, the parameters are basically age, gender, smoking status, and systolic blood pressure, high density lipoprotein, and total cholesterol level. These all are basically dynamic parameters. So it basically changes all years. So the maximum number of years which can be assessed during using this Framingham Risk Score is 10 years. So it is assessing the risk of 10 years for the development of cardiovascular diseases in a, you can say, healthy control, or in a, you can say, participant adults. Basically the Framingham Risk Score has a wide range of, you can say, usefulness, and this basically ranges from identification of cardiovascular events to prevention and to treatment of the disease. And once the scoring is done, it will give in the points. So there are certain points which is given to the patients for their lifestyle, and these points are basically from ranging from 0 to 30 or even more. So low risk have 10% or less CHD risk. If 10% or less, low risk means ki 10% or less CHD risk. In intermediate risk, that is 10 to 20%, and high risks are known when 20% or more, you can say, the corresponding points are allotted to the patient, or you can say calculated from the patient's description. So validation was done in US, both in men and women, and both in European Americans and the African Americans. So different cohorts of Americans were assessed using this Framingham Risk Score in the study, that was a coronary heart study. So scoring system basically depends is dependent on the men and women. So it is, you can say, gender oriented or sex oriented kind of scoring system. So for men and women, you can see that different points are given. If your age is 20 to 34, then you will be given 9 points. But in case of female, you can say if you are 20 to 34, you will be given 7 points. But when you see between 75 to 79, men is given 13 points and women is given 16 points. So women has a kind of, you can say, higher scoring system or high score than the men. And so is the case with, you can say, other parameters like SBP, systolic blood pressure, and relatively same in the smoking status and the high density lipoprotein level in the blood. So guys, these are basically the scoring system. You can go through it. If you want to calculate for yourself, then you can use it. You can have your assessment done for the high density lipoprotein concentration in your blood and the total cholesterol level. That is also dependent, that is also basically having different, you can say, cadres. Different cadres have different points, and these points is submitted, and then the summation will give you a risk percent. That suppose if you have total of 17 points or more, then you have 30% of risk of developing the cardiovascular disease, you can say, as this is in the man's case. And in women, you can see that 30% is have a 25 or greater points. So you can say women has higher points than the same risk, and men has the same, you can say, lesser points and then the same risk of developing the cardiovascular diseases. So guys, this is a matrix which looks like this only. You can see this is a descriptor which is getting encircled, or you can say this is a checklist kind of thing. If you know all the 6 parameters, then you will have a kind of, you can say, scoring done for yourself. So this is very important to know all the parameters. Yeah, earlier you can see that there was diabetes which was considered from 2002. It was discontinued, and diabetes is now no more the parameter for assessing the cardiovascular risk using Framingham Risk Score. So guys, limitation, it is basically dependent on the, you can say, stroke, transient ischemic attack, and heart failure. These kind of diseases are not assessed using this. The only coronary part of the cardiovascular event is getting assessed with this kind of scoring system. It is sometimes overestimated and underestimated in case of the other US populations. As you have seen that European and Caucasian, all the USA personnel were in the cohort, but some other cohorts, like you can say, if you are going to assess in India, Brazil, then the scoring matrix would underestimate or overestimate your basically risk. It is just an arbitrary estimate, so you have to consult a cardiologist after having a kind of assessment. So this is not a kind of strong or firm statement given by this. So guys, thank you all for watching this video. I hope you have enjoyed the video. Please hit the like button and subscribe to my channel, and share the video to the needy ones. If you liked it, please subscribe to the channel. Thank you guys, thank you so much.